Today we're talking about meniscus injuries in children. This is a common cause of knee pain, especially in very active children and young athletes. So welcome back to Little Growing Bones. My name is Judith Nasazi, a pediatric orthopedic surgeon. If your child has knee pain, swelling, or trouble bending their knee after a fall or twist, this video is for you. So stick around till the end. I'll share some simple home tips for recovery and an important message for parents about protecting their child's knees. What is a meniscus? So a meniscus is the small C-shaped piece of cartilage inside the knee. Each knee has two of them, one on the inner side and the other on the outer side. So they act like shock absorbers inside the knee. They protect the bones and they keep the knee stable when your child runs, jumps, or twists, or does all kinds of crazy things that children do. When the meniscus gets torn or injured, it can cause pain, it can cause swelling, and even difficulty moving the knee. So if your child is active in sports, keep watching this video. Understanding how the meniscus works helps you spot these kinds of things early and prevent long-term problems. What are the causes of meniscus injuries in children? So meniscus injuries in children can happen in two main ways. One is mostly through sports or active play. So a sudden twist, a sudden squat, or a pivot, especially in football, sports, netball, basketball, netball, can tear the meniscus. The second thing is that some children are born with something called the discoid meniscus. So some children are born with a thicker disc-shaped meniscus called the discoid meniscus, and these are more likely and more prone to tearing. So if your child plays sports often, make sure they warm up well, they stretch properly before the activity. It's one of the best ways to prevent these kinds of injuries. How do we spot meniscus injuries? What are the signs and symptoms of this? So how do you know if your child might have a meniscus tear? So look out for these signs. One is knee pain, especially along the side or the center. They could have swelling within a few hours after the injury around the knee. There's clicking or locking sensation in the knee. They have trouble fully bending or straightening their knee. They could present with limping or refusing to actually walk on that leg. So if your child has knee pain that lasts more than a few days and it keeps locking or clicking, don't wait. Book a visit to a pediatric orthopedic surgeon. Early diagnosis makes the recovery faster and prevents long-term sequelae and long-term damage to the rest of the knee. How do we diagnose and treat this? When you visit your doctor, they'll explain, when you visit your doctor, they'll examine the knee and they may request you to do an MRI scan to confirm the diagnosis. The treatment typically depends on how bad the tear is. So for minor tears, these often improve with the RICE protocol, rest, ice, compression, and elevating the leg. Some physiotherapy will be required and strengthening of the muscles around the knee is also important. For large and persistent tears, they may require orthopedic surgery. A simple minimal invasive surgery known as arthroscopy could be used to repair or take out the damaged part. So don't be scared about the word surgery. Children recover quickly. Modern arthroscopy allows them to heal well and return back to activities that they want. Let's talk about a few tips and tricks for parents. So here's what you can do to help and protect your child's knee. One, encourage warm-ups and stretching before they do the sport or dance. Make sure that they wear good shoes and proper support when they're doing these activities. Teach them to listen to their bodies if they feel pain, to stop and rest. Also follow the rehab plan that is given to you by your doctor, specific the injuries that they have sustained, and allow them to slow down when they get these injuries. Give healing time to happen. So be slow with them. So if you're a parent of a sporty child, it could be helpful to know these tips so you prevent further injury in the future. I know knee pain in children can be worrying, especially if your child loves sports, but here's the good news. With the proper care, most children recover completely from meniscus injuries and they go back to all the activities that they enjoy to do. But early attention, patience, and consistency, and follow up, just seeing how they're doing will help them get better. So don't ignore persistent knee pain. Listen, check, and act accordingly. Your care and encouragement are the best medicine your child can ever have. So if you found this video helpful, please give it a thumbs up. It really helps most parents find this kind of information without misguided information online. So subscribe for more parent-friendly explanations about children's bones, joints, and muscles. And remember to share with other parents groups and other parents who might have children going through this. And until next time, keep it on Little Growing Bones.